Memorial is the main sponsor of the First There, First Care conference, which is South Florida's largest EMS conference, and it's made up of EMS personnel, EMS chiefs, doctors, nurses, anyone in the EMS community. The theme of this year's conference is the past, the present, the future, which is pretty telling considering the last couple years that we went through. You know, reflecting on the past, assessing where we are right now, and then looking forward to the future in a very different and changed landscape.
Memorial healthcare system has been with us from the very beginning, whether it be helping us with our continuing education units, getting speakers, getting presenters. Memorial has been an integral part of this whole process.
It's a week-long event. It starts with an advanced life support challenge with EMS, and it goes throughout the week with a nursing challenge and competition. We have lots of hands-on interactive sessions. We have a leadership symposium, tons of hands-on activities. We have EMS chiefs meeting, fire chiefs meeting, and it ends with the culmination of the international conference of the Eagles, which is the EMS medical directors from across the world.
We have EMS state meetings taking place, the Gathering of Eagles, 100 medical directors from the largest metropolitan departments all over not only the country but the world.
We're kind of being known around the country now as one of the best stroke care areas, the best cardiac arrest survival rate. It's not just EMS going and dropping the patient off at the door anymore. It's a continuum of care and sharing of the knowledge between EMS and the hospital, and that way we can provide cutting-edge patient care.
Solidifying our relationship with our EMS colleagues. You know, they bring us our trauma patients every day, and so their actions in the field often dictate the survival of these patients that we help continue on in the hospital.
It takes a village. You know, we can't do our job without EMS, ER, etc. So we all have to work together, and we really do God's work, you know, as a team.
The relationship building that's done in the off time manifests itself with success when things are actually happening. These relationships have been strengthened through the years. Our crews have better relationships with the ED, and as an administrative chief, we have better relationships with hospital administration, so we can solve problems.
When you look at what this field of medicine, which really it's one of the youngest fields of medicine, what's been able to accomplish just in the last few years, just to see with the pandemic, and how it's been able to save us as a society when it comes to taking care of folks that don't have access to health care, taking care of homebound people, working with strike teams to go out to vaccinate the long-term care facilities, etc. I mean, this is where innovation starts, and this is where we intersect with all the rest of healthcare.
Memorial has a long-standing history of taking the lead in the community and being leaders for our community, being role models, setting the standard. We're proud to do that, and we're going to do even more of that going forward.